Hayden and myself are based at the University of New South Wales at the National Drug and Alcohol Research Centre, and for the next 15 to 20 minutes, we'll be walking you through all things vaping and e-cigarettes, particularly related to the current evidence base and where things are up to. Slide, please, if that's okay. Thanks. So, smoking tobacco. So the risks to health are almost completely from tobacco smoke as opposed to nicotine. Smokers should be encouraged to stop smoking completely. Support is available and increases the chance of quitting for good. For those that do struggle to quit smoking, there are non-combustible nicotine use is a harm reduction approach. Slide, please. So for the continuum harm, if you look at the tobacco space or nicotine space as well, with a continuum of harm, we can see on the left, obviously no use is no harm. And then to the the right, we have severe toxicity from smoking combustible cigarettes, and that harm moves its way up through nicotine or nicotine replacement therapy and e-cigarettes up to smokeless tobacco that's often used in Scandinavian or Norwegian countries, including snus. So you can clearly see there that there's a big difference between the effects of smoked tobacco versus those from products that have less harm that do contain nicotine. Slide, please. So the disease burden and costs of tobacco use are still quite staggering in Australia. Tobacco use globally is a leading cause of preventable death, around 8 million deaths per annum, and the projection of number of deaths per annum by 2030 is around 8 million. Still in Australia, we have approximately 3 million smokers aged 14 over, around a population rate of approximately 13%. And the social costs from smoking are quite enormous, actually, with $31 billion of social costs annually. Australia does have one of the lowest smoking rates globally, but we need to continue our incremental and assertive public health strategies to reduce smoking rates. So we did have a target of 10% nationally set by 2018, and now this has been reset again to 10% by 2025. And I think we need to acknowledge that there still are particularly high rates of smoking among some populations, including some of the clients, particularly at-risk youth, that some services here may see from a day-to-day perspective. And the rates of smoking are really quite high still, considering the amount of taxation and costs of tobacco over a sustained period of time. Slide, please. So there's both behavioural and pharmacotherapy options, and these two graphs here just present the increase in 6 to 12 months abstinence when either behavioural support or pharmacotherapy is adopted, all the way from unassisted, not doing anything at all, up through to both individual and group-based support. And then on the right, you've got pharmacotherapy, once again, unassisted, all the way up to currently the most effective sole treatment is varenicline, but we'll go on later to talk about vaping and e-cigarettes for smoking cessation. Slide, please. So what are ENDS? So they're battery-operated products that heat and aerosol a liquid that usually contains propylene glycol, vegetable glycerine, flavouring, and nicotine. There's generally three parts: a battery, a tank or pod for the e-liquid, and a coil or heating element. As you can see there, there's an array of vaporizers all the way through from your first sort of cigarettes to pod models and refillable models. The pod models have a replaceable pod of e-liquid activated via breathing with no pod, whereas the cigarette has usually a button. And then you've got refillable models that are larger and more complex with adjustable settings Most smokers start with tobacco flavouring, as it is familiar, and then they shift to fruit or other flavours. You can see there the pods at the top right, containing nicotine solution, and then also those that contain CBD or cannabidiol. And I'll discuss that in more detail related to the Avali outbreak that happened late last year. A staggering, I think, statistic, or looking at the costs compared to tobacco. So a pack of cigarettes, around 20 cigarettes a day, smoker would spend around 10 grand per annum, whereas a simple pod device costs around $40, depending on which one you buy. And the replaceable pods can be around $3 to $6. And vaping with refillable tank probably costs close to just over $1,000. So it's probably around 80 to 90% less expensive than smoking. More recently, the Royal Australian College of General Practitioner have approved the use of vaping products containing nicotine for those that have tried other methods and failed to quit. But the climate is a lot different in Australia compared to the US, Canada, and New Zealand as well. Access is quite restricted at the moment, as nicotine is classified as a Scheduled 7 dangerous poison, and importation, use and possession of liquid nicotine for therapeutic use for those that want to quit or reduce smoking. They are legal if the user has a prescription from an Australian medical practitioner, and then they become a Scheduled 4 prescription-only medication, and it's permissible to possess or use it for personal use. Then it's legal for a doctor to write the prescription, which is a lot different compared to overseas, where often these products can freely be available and bought overseas. Next slide, please. So I think it's important here, I won't go through the mechanisms of nicotine per se, but I think it's important to recognise that people smoke and smoke for the nicotine, but die from the tar. That's a famous quote from Mike Russell in the 1970s, when nicotine replacement therapies were really started to be looked into. Next slide, please. So this slide here just shows the nicotine delivery from a combustible cigarette. And then next slide, thanks. So here we're looking at the nicotine delivery from cigarettes versus some of the older style nicotine replacement therapies that have been around for quite some time. As you can see, that the peak nicotine delivery happens a lot quicker and sustained for a bit longer period, as to compared to those with gum or the other nicotine replacement therapies. So one of the key issues, I think, with nicotine replacement therapies previously has been their ability to deliver nicotine swiftly. Next slide, please. So nicotine delivery from electronic nicotine delivery systems in general, the faster the nicotine delivery, the more likely the product is to be more satisfying, be better at alleviating tobacco withdrawal symptoms, and have greater dependence liability. So once again, you can see some of the older style e-cigarettes or vaping products, Vuse and Inikin, were nearly performing as well as cigarettes, but not quite. So if we move to the next slide, thanks. So Juul, quite a controversial product at the moment. It's a cartridge type device that's become very popular, particularly in the US. And a recent independent study looking at nicotine delivery from Juul device among human smokers, as you can see there, found for the first time, really, we're looking at a device now that can deliver nicotine nearly as well, if not as well, as combustible cigarettes, hence probably the high user acceptability in their ability to deliver nicotine. Next slide, please. So Juul related to craving relief, once again, we look at the time on the x-axis down the bottom, and then on the y-axis on the left, the urges to smoke. You can see once again that its ability to relieve cravings is quite substantial. Juul Juul relieve craving almost as quickly as combustible cigarettes, but currently there are no trials that have examined the efficacy of Juul for smoking cessation. But these data suggest that they could be helpful when used to assist people that wish to abstain from combustible cigarettes or quit smoking. But obviously a possible downside to this is long-term use may be more likely given its ability to deliver nicotine so well. And we need to balance the risk of uptake, especially among non-smokers. Next slide, please. So there was a recent outbreak in the US. The first cases occurred in August 2019. As you'd be aware, it received high media attention and public interest, and it was called the EVALI outbreak, or e-cigarettes or vaping product use associated lung injury is what EVALI stands for. And by February 2020, there were over 2,800 cases of lung injuries and 68 deaths across all 50 states. And as you will notice that originally there was a lot of hype and indications that all types of vaping, particularly even cleaner forms of e-liquid containing nicotine, was harmful. However, on further scrutiny of the case reports and the data presenting to hospitals, it's clear that vitamin E acetate was found to be heavily associated with vaping-related illness. And vitamin E acetate is an oil derivative used in vaping products as a thickener. And vitamin E acetate usually does not cause harm when ingested as a vitamin supplement or applied to skin, but when inhaled, interferes with normal lung functioning. And the Centers for Disease Control has urged everyone to avoid e-cigarettes or vaping products containing tetrahydrocannabinol or THC. So the take-home message after we synthesised, or the literature has really been critiqued, is that don't add substances to e-liquids, as we can see what the catastrophic effects have been for those that do add THC. Next slide, please. So that's the update on the EVALI situation, but it really led to a slightly changed landscape, with some countries actually banning e-cigarettes, and obviously in the US as well, some banning of flavours. But Public Health England continues to endorse e-cigarettes as a safer option than cigarettes. Next slide, please. So this is a bit of a thought-provoking question, though. Is it time to realign our approach? And from one of the most respectable journals in the field, surely is it time to align the public health approach, e-cigarettes, with that of cigarettes? So I'll now pass on, next slide, please, to Hayden McRobbie now.
Thanks, Ryan. And just, I guess, to recap at this stage, that there are a whole wide range of electronic cigarettes or vaping products, or the other terminology that Ryan used was ENDS, which is electronic nicotine delivery systems. They've changed over the last 10 years or so that they've been available. And now we see that we've got products that can deliver nicotine efficiently and as quickly as smoking. So this would be a really good thing for people who want to quit smoking, but potentially a bad thing if you've got never smokers that are starting to use these products and get hooked on them. So you can see where the questions come, and perhaps the debate from two sides of the fence. But first of all, I'm just going to talk about the question, can these electronic nicotine delivery systems actually help people stop smoking? If I can have the next slide, please. This is just going to review some of the evidence from the Cochrane Library, the systematic review on electronic cigarettes, specifically for smoking cessation. And this update was published earlier this month. Next slide, thanks. So the review, what did it look at? Well, this review includes evidence up until January 2020. And it includes randomized control trials, which generally give us the best and most reliable evidence when we're looking at the effects of treatment. And these trials compared electronic cigarettes with nicotine compared to electronic cigarettes without. They also compared e-cigarettes with other products such as NRT, your gum, your patches, your lozenges, etc. And there was also a couple of studies that looked at using electronic cigarettes in combination with nicotine replacement therapy. We also included some cohort studies, especially for our outcomes that looked at safety. What these studies had to include was at least 6-month follow-up. Because you want to see longer term, or this is medium to long term smoking cessation. And when the studies were looking at side effects, they needed to include follow-up for at least a week. Now, this update included 50 studies, over 12,000 adults who smoked. And this review is actually a living review now. So we're going to be running monthly searches from next month. So it looks like we'll have a happy Christmas and New Year looking at more of the evidence. Fingers crossed there isn't too much more to look at. But this gives us a chance to update the evidence as we go, as opposed to waiting for another 4 years, which is what we did. Next slide, please. Okay, so I just want to share the headline results here. So overall, the evidence that vaping products or electronic cigarettes can help people stop smoking has been strengthened. And it's because we've got a few more studies now to include in the analyses. So the headline results are that more people probably stop smoking for at least 6 months using nicotine e-cigarettes than using nicotine replacement therapy or using nicotine-free e-cigarettes. So the evidence is, we're fairly certain around this, which is why they probably help people stop smoking. The evidence that e-cigarettes are more helpful than no support or behavioural support only, we're less certain on. So we would like a bit more evidence there before we can raise that certainty. But in general, if 100 people tried to quit smoking using electronic nicotine delivery systems, then we can expect that around 10 people would stop smoking long term. Compare that to 100 people using nicotine replacement therapy, around 6 would stop smoking long term, and out of every 100 people that use behavioural support or no support at all, around 4 people would stop smoking long term. And those figures are about right to what Ryan showed you before. Overall, though, I think you can appreciate here, we're not talking about magic cures or silver bullets. Stopping smoking is a very challenging thing for many people to do. And although we've got some evidence now to show that e-cigarettes can help people stop smoking, you can see that long-term quit rates still remain pretty low. Next slide, please. In terms of adverse effects, there are very low numbers of adverse effects across all study groups. So we couldn't really determine any true difference between users of nicotine-containing e-cigarettes versus NRT. What we do know from these data are there are some common side effects of e-cigarette use. These are mostly short-lived, but include things like throat or mouth irritation, headache, cough, and nausea. We didn't find any significant difference between the groups in terms of serious adverse events. Next slide, please. So, summary findings here, and this is directly from the Cochrane review. ENDS or e-cigarettes probably do help people stop smoking for at least 6 months. They probably work better than nicotine replacement therapy and nicotine-free or zero nicotine electronic cigarettes. They may work better than no support or behavioural support alone, and they may not be associated, their use may not be associated with serious unwanted side effects. But just to caution, the 2 bullet points there at the end where we've got may, it means there's still some uncertainty around the evidence. Next slide, please. In terms of real-world evidence of this, there are some studies both that both support and don't support what we found in the Cochrane review. But first up, here's some data from the UK. Large sample size here of over 18,000 participants. And when they looked at smokers that had made a quit attempt in the last 12 months and what they used, there were two particular interventions that were found to be associated with quitting, and that was e-cigarette use and varenicline or Champix. And actually, varenicline is currently the most effective aid for smoking cessation. Next slide, please. Another example here, this time from the US, and these data from the PATH study. And essentially, the key message here is that at a population level, e-cigarette use by smokers, and especially those with chronic medical conditions, was associated with more quitting activity and also quitting smoking. So those that were using e-cigarettes were more likely to make a quit attempt, and if they were using e-cigarettes, more likely to quit than if they weren't using e-cigarettes. Next slide, please. I just want to mention safety here because I think this is something certainly my patients always ask me, do they help me quit smoking and are they safe? I think the key message here is they're not 100% safe. What I like to say is that they are less harmful than smoking. Next slide, please. Oops, if we can go forward again, thanks. In terms of health risk, and these were the conclusions from a big review done in the US a couple of years ago, and they concluded that actually e-cigarettes weren't without risk, but less risk than tobacco. So it all depends on where you're coming from. If you're a smoker, if you're a current smoker who switches completely to vaping and stops smoking, then you will expect to see a reduction in your health risk. However, if you're a never smoker, especially a young never smoker who starts vaping and becomes a regular vapor, then there is likely to be some long-term health risk associated with that. However, we're not exactly sure of what that level of risk is, and it will take some years yet until we fully understand that. Next slide, please. There are substances that are potentially harmful. For example, if you overheat vegetable glycerin, then you can get aldehyde formation, which are toxic and irritant to the respiratory system. There are metals in the devices, such as the battery, obviously, and the heating element that aerosolizes the liquid contains metal, and so you can get metals appearing in the vapor. The liquids, nicotine's probably the least of our worries, although of course you want to keep these high strength nicotine products out of the reach of kids. But it's probably going to be the flavorings that will cause most concern. And we already have an inkling from data so far that some of the flavorings, for example, those listed there, that may be more problematic than others. Next slide, please. But I just wanted to also highlight that the presence of these toxicants doesn't necessarily translate to harm, because harm's related to exposure. And this is the same with smoking, of course. And you will know if you stop before the age of 35, then your risks of smoking-related illness revert to that of a non-smoker. It's really once you've had many years of smoking and exposure to toxicants that the smoking-related illness appears. And this is going to be the same with vaping. And that's why we haven't seen any concerns or serious concerns come up with vaping-related illness yet. But perhaps after another 20 to 40 years of use, maybe we'll start to see these start to emerge. A complicating factor to all of this is that most people who vape are either current or former smokers, so trying to tease that apart will be a little bit difficult. Next slide, please. In terms of offering help to people who smoke, this goes across all age groups. If you have someone who smokes, then make sure you're first screening for smoking or tobacco use. For those that do smoke, give brief advice. Explain what you can offer. And in general, the best thing that you can offer is a combination of stop smoking medicines and behavioural support. So nicotine replacement therapy with Quitline, for example. I'm in New Zealand, we've got a very good local stop smoking service, so I try and encourage people to get down there. But occasionally you will get people that ask about e-cigarette use. And I always say, look, is it okay if I tell you what I know about them? Because my job is to try and get through the murky details sometimes and try and communicate what I know. And it is this: they can help people stop smoking, but they're no magic cure. So some effort's still going to be needed. I know that they pose less risk than tobacco smoke, but we don't know the health risks that might be associated with long-term use of electronic cigarettes. And of course, any electronic cigarette, nicotine containing or not, shouldn't be used by people who don't smoke. Next slide, please. In terms of people are going to use e-cigarettes or ends for stopping smoking, then daily use is generally associated with better outcomes. More advanced models that deliver nicotine more efficiently tend to work better. That people should read the instructions from the manufacturers and keep them safe. These are electronic devices. You shouldn't use them in the bathtub or anything else like that. Don't carry coins around in your pocket with the batteries. That's where things go wrong. It does take a little bit of practice to learn to use the device properly and to get the right amount of nicotine out of it and relieve your urge to smoke. And I think one of the best messages you could give would be to stop smoking combustible cigarettes as soon as possible. And because we don't know the long-term risks, then I always advise people to, as soon as they feel safe, they're not going to go back to smoking, aim to stop using electronic cigarettes as well. Next slide, thanks. And don't forget to document all of this. Remember, use of electronic cigarettes is not a combustible product. So if someone has completely switched from cigarettes to e-cigarette use or ends use, then they should be categorized as an ex-smoker. But if they're still smoking cigarettes, then they remain a current smoker. Next slide. And just to finish, so in summary, e-cigarettes, yes, they can help people stop smoking, but not a silver bullet. They are likely to be associated with some adverse health effects in the long term. So concerns warranted here, but we always have to balance up the potential risks of long-term use versus the risks of current smoking and people who smoke. And for smokers who do manage to switch, the key message there is to stop smoking completely, and that this is likely to be associated with a reduction in the health risk. This is supported by the literature, but as I said, to mitigate any concern over long-term health risks, advise people to stop vaping as soon as they're able to not go back to smoking. And that's it from Ryan and I. Ryan, I don't know whether you want to add anything else to that. Otherwise, we'll hand it.
Yeah, happy to hand over. Thanks.
Pat, thanks.
The question is around, what would you say are the key messages to young people are in schools who are vaping? Anyone would like to contribute to that question?
Maybe it's Hayden here. Maybe I can start because there are a few questions that have come up here. I think we need to be very clear with our messaging that for people who do not smoke, they should not vape, or to the contrary, vaping is for people who smoke only. And I suspect that the message has been slightly blurred in that when, for example, Public Health England have said, well, they're 95% safer than smoking, that message has come across as that vaping is safe. Vaping is not 100% safe. It's less harmful if you smoke, but if you don't smoke, there's likely to be some harm. We don't know what that is yet, but there is almost certainly going to be some degree of harm associated with long-term use. And I think someone also raised the fact that these people are in the US have become addicted, especially with using products like Juul, which, as you can see from Dr. Courtney's presentation, can deliver nicotine really quickly and is almost as good as smoking. So I think this is where we've seen in the US this uptake of especially these very efficient nicotine delivery systems in young people that don't smoke. The other difference, of course, in the US too, is there's much less control in terms of their advertising. Only recently have they started to look at restricting this. If you look at the EU and the United Kingdom, there have been regulations in place since 2014 with the Tobacco Products Directive, which limits sales to those over age 18 or 18 and older. They limit any advertising, and they also limit the maximum concentration of nicotine that can be contained in these devices. And the UK, at least, hasn't seen this large increase in young never smokers starting to vape. So I think that it's going to be a difficult time. Just a comment from Natalie about prosecution of people. Are the police notified? Will the students be legally implicated? That shouldn't be the case. It should be the sellers that are visited by the police and not the people themselves. So some education around all of this, I think, will be absolutely critical. It's going to be interesting in Australia versus New Zealand. In New Zealand, we have our Smoke-Free Environments Act that's been amended and will come into force on the 11th of November. This does allow the sale of nicotine-containing electronic cigarettes, but not to minors. Advertising will be banned, and also flavours will be limited as well. So there's a number of different steps that will be implemented at different time points. I hope I've answered some of those questions.
Thank you to all our presenters, great job, and to our audience for taking the time to be with us this morning.